Hello and welcome to our webinar on getting started on your Dexcom G5 continuous glucose monitor. My name is Michelle. I'm a certified diabetes educator here at Dexcom, and today I'm going to be reviewing how you can set up your Dexcom for the first time, how you'll use it on an everyday basis, and some of the benefits it will provide you. So your Dexcom will provide you with continuous glucose readings that will update every 5 minutes. And even if you're not actively looking at your Dexcom, it's there to alert you when your glucose is too high or too low, prompting you to take potential action to bring your glucose back within your target range. Now, your Dexcom will also show you the speed and direction of your glucose, which will help you take a more proactive approach when managing your diabetes. And over time, your Dexcom can help you and your physician focus on the detection of your glucose trends and patterns, which will help you and your doctor make much more targeted and effective adjustments in your treatment regimen. Now your Dexcom, it consists of three different components or three different parts. Figure 1 labeled here is a sticky sensor pod that's placed on your skin with a thin flexible sensor wire just beneath it. And that sensor wire sits in the fatty layer of your skin and continuously measures your glucose. Figure 2 labeled here is your transmitter. It's a small gray rectangular piece that's placed right on top of your sensor pod, and it wirelessly transmits the glucose information over to your display device labeled here in figure 3. So it's your display device that displays your continuous glucose readings and provides you with an alert when your glucose is too high or too low. Now with the Dexcom G5 system, you have the option of using two different types of display devices. You can either just use the Dexcom G5 touchscreen receiver that came with your device, or you can use a compatible smart device. You can even use both the receiver and the smart device at the same exact time. You can even interchange between the two. So for example, you could use your smart device during the day and your receiver at night, or vice versa. And we have a list of compatible smart devices on our website at dexcom.com. But if you're planning on using both the receiver and the smart device at the same exact time, there are some tips we should review with you. One is that you should only calibrate one device. That calibration will automatically get shared with the other device within about 5 minutes. However, when you receive an alert, such as an alert for a high or a low glucose, you will receive that alert on both devices, and you will need to clear or silence the alert on both devices separately. But we're first going to focus on how to set up the receiver. So to turn the receiver on for the very first time, you're going to press and hold down on the power button at the bottom of the device for about 2 seconds. This will result in a loading screen. The loading screen will disappear on its own within about 15 seconds and then display a welcome or introduction screen. When you see this, tap the word OK, and this will launch a series of setup screens. One of the first setup screens will ask you to enter the date and the time. The date will be displayed as the year, the month, and the day. So to edit any one individual field here, you'll simply tap on that field to highlight it in green, and then tap the up and down arrow symbol to edit that highlighted field. So if, for example, you want to edit the year, you'll tap on the field for year so that it's highlighted in green, and then tap the up and down arrow symbol to edit that highlighted field or to find that correct year. Once you've entered in the correct date and time, the receiver will then ask you to enter your transmitter serial number. So your transmitter is a very small gray rectangular piece that comes in a different box than the box that your receiver came in. It comes in a very small white and green box with a photo of the transmitter on the outside of it. Now, each and every transmitter is assigned its own unique transmitter serial number that you can find either on the very back of the transmitter itself or on a white sticker located on the back of the transmitter box. Your transmitter serial number is a series of 6 letters and numbers that starts with the number 4. And you need to enter this number into your receiver so that way your receiver knows specifically which transmitter it needs to communicate with. Once you've entered in your transmitter serial number, the receiver will ask you to enter your high and low glucose alert, or the level at which you want to be alerted for a high or a low glucose. Now, when setting your low alert, you may want to set it just slightly higher than what you consider a hypoglycemic episode to be. That will just help ensure that your Dexcom really does what it's intended to do, which is to alert you right at the beginning of that hypoglycemic episode before it gets too severe. When setting your high alert, some people choose to set it at the upper limit of their target glucose range at, let's say, 180 or 200. However, other people feel that that would be alerting them too often, and they choose to set it at a much higher level, or a level at which they would consider taking action, such as a correction dose of insulin, for example. So now we're going to review how to set up the smart device. So if you're using the smart device, you need to first install the Dexcom G5 Mobile App, which you can find in the Google Play Store on an Android or in the App Store on an Apple device. Now, once this app is installed and you open it for the very first time, it will ask you to log in with a username and password. So if you have created an account with Dexcom in the past, such as a Dexcom CLARITY account, for example, use that same username and password to log in. If you have never created an account with Dexcom, tap the sign up option and create a username and password. But once you've successfully logged in, the app will walk you through some safety statements, ask you to set your low and high alert, and ensure that you have your Bluetooth turned on. So your smart device will use Bluetooth technology to communicate with the transmitter on your skin. So in order for you to get continuous glucose readings on your smart device and receive alerts, you need to keep Bluetooth turned on at all times. Also, you need to keep the Dexcom G5 app continuously running in the background in order to receive your continuous glucose readings on your smart device. But once you've ensured that your Bluetooth is turned on, the app will then ask you to enter your transmitter serial number and ask you to perform a sensor insertion. At that point, you'll want to make sure that you perform a sensor insertion before proceeding any further in the app setup. And in a moment, I will demonstrate for you what that sensor insertion process will look like. But prior to placement of the sensor, you have the option of using 2 different types of medical glue or adhesive on your skin. The 2 brands that you can choose from are Mastisol or Skin Tack. Now, if you choose to use these, you should apply them in what we call a donut fashion on your skin, meaning you should apply them in an oblong oval shape, leave the center of the oval exposed without any overlying medical glue, so that way when you place the sensor pod on top of it, you can line it up so that the needle will just puncture through your skin and not through any of that overlying medical glue. So now I'm going to review the parts of the sensor applicator, or the device you're going to use to apply a new sensor to your skin every 7 days. Now this diagram is color-coded for teaching purposes, but in reality, your sensor applicator will be clear. One of the first parts I want to point out to you is the safety lock labeled here in green. The safety lock is present to prevent you from accidentally depressing down on the plunger before you should. But once you have that sensor stuck to your skin, you'll remove that safety lock so that you can then press down on that plunger with your thumb. When you do that, that will insert the needle into your skin with a little thin flexible sensor wire inside of it. You then need to remove that needle from your skin, and you'll do that with the collar labeled here in yellow. You'll glide the collar up to the very top of the applicator barrel, and that will remove the needle from your skin so that it leaves just a very thin, flexible sensor wire inside of your skin. Now, one tip about those two steps is you want to make sure that you initially position your fingers above the collar when you depress down on the plunger with your thumb. Now, that will be contrary to your natural instinct, but that will help ensure that you don't pull up on the collar too soon. So once you press down on the plunger all the way, then you'll move your fingers below the collar in order to glide the collar up to the top of the applicator barrel. Once you glide the collar up to the top of the applicator barrel, you'll then remove the applicator barrel from the sensor pod using the release tabs labeled here in fuchsia. The release tabs are these ridged, ribbed, kind of grippy tabs at the base of the sensor pod. There's a release tab on each side at the base of the sensor pod, and you will squeeze or pinch these release tabs, and that will release the applicator barrel from the sensor pod. You'll then use the transmitter latch labeled here in purple to help you snap a transmitter down into that sensor pod. Now, one of the first things you also want to think about is where you want to place your sensor. So if you're an adult patient over the age of 18, you have the option of placing the sensor on your abdomen. If you're a pediatric patient under the age of 18, you have the option of not only placing it on your abdomen, but you can also place it on the upper buttocks. If you're somebody who is on an insulin pump, you want to make sure you pick a sensor site that is at least 3 inches away from your infusion set for your pump. If you're somebody who administers insulin injections, just bear in mind that you want to perform your insulin injections at least 3 inches away from wherever your sensor site is. So once you find a good spot, you want to thoroughly clean off your skin with a plain alcohol pad. If you're using skin tack or mastisol, you would apply it at that time once the alcohol is completely dried. You would then grab your sensor applicator and peel the 2 white pieces of paper off the back of the adhesive, and then just stick that sensor pod on your skin horizontally. Once it's stuck to your skin, make sure you press down on the white adhesive with your fingers to help create a good seal. Once you've got that sensor pod sort of stuck to your skin, you're then going to remove the safety lock. So the safety lock is this piece right here. So with one hand, you'll grip onto that applicator barrel, and with the other hand, you'll grab onto that safety lock and just pull that safety lock out and away from that applicator barrel. You'll put that safety lock aside, and before I demonstrate the next step to you, I want to point out to you the collar. The collar is this ring or this rim that sort of sticks out at the bottom of the applicator barrel. During this next step, you want to be real careful that you keep your fingers above the collar. So with one hand, you'll very gently place your thumb on top of the white plunger and keep your index finger and middle finger around the applicator barrel, but above the collar. Again, your instinct is going to want to be to do this, but make sure you don't do that. Keep your fingers above the collar. Your other hand is going to pinch up on your skin in front of the white adhesive. And then when you feel ready, you will press down on that white plunger with your thumb. You may hear 2 clicks at that time. Then you can let go of your skin. That hand can be free, but continue to keep your thumb on top of that depressed white plunger. And then move your index finger and middle finger below the collar, below the ring of that collar, and glide the collar up the length of the applicator barrel, almost to the very top of that applicator barrel. So that collar will almost be flush with the top of that white plunger. Once you do that, you can then remove this applicator barrel from the sensor pod. To do that, you need to first locate the release tabs. So with your thumb and index finger, you'll locate the release tabs at the base of the sensor pod. Now the release tabs are a little hard to see. You can almost feel them better than you can see them, but they are these ribbed tabs at the base of the sensor pod. So you'll grab onto these release tabs and you will pinch them as hard as you can, and then tilt this applicator barrel forward and out from your body, and that will leave a very low profile sensor pod on your skin with a little transmitter latch attached. You'll then need to attach your transmitter to your sensor pod. So you will grab your transmitter and you want to make sure that you clean the back of the transmitter with a plain alcohol pad. Once you have that transmitter cleaned off, you'll go ahead and snap that transmitter down into the sensor pod. Now you'll notice that your transmitter, it has a narrow end that says G5, and you want to insert the G5 end of your transmitter into the front of the sensor pod, the side opposite of the transmitter latch. So if this is the sensor pod on your skin and this is the transmitter latch, you're going to insert that G5 end into the very front of the sensor pod, the side opposite of the latch. So you insert that G5 end into the very front of the pod, the side opposite of the latch. And then you will just lie that transmitter down just so it's resting right on top of that sensor pod. And let me show you another angle here, but you're going to wedge that G5 end into the very front of the sensor pod. Just lie that transmitter down just so it's resting right on top of that sensor pod. It's not clicked into place yet, so you're going to use this transmitter latch here to snap it down. So with one hand, you're going to hold that transmitter in place. With your other hand, grab onto this transmitter latch and push the transmitter latch towards the transmitter until you hear 2 clicks. And you have to pull really hard on that transmitter latch until you hear 2 clicks. Once you hear 2 clicks, you can break off this transmitter latch. So with a twisting motion at your wrist, you're going to twist, and that's going to break off that latch. Now, it can be rather surprising just how hard you have to push on that transmitter latch to hear those 2 clicks. Even if you think you heard those 2 clicks, I recommend that you visually inspect the back of the transmitter to make sure that you got it snapped down all the way. What you can do is focus in on the back end of the transmitter, the D for Dexcom end. When you look at that back end of the transmitter, you'll notice that there are these 2 little gray triangular shaped corners that sit just below these clear wings of the sensor pod. You want to make sure each triangular corner is fully seated below these clear wings of the sensor pod. If for some reason you did not get that transmitter clicked in all the way, or you only heard 1 click, what you would see is that one little gray triangular corner is sticking up just ever so slightly above this clear wing. You can see on this side, this triangular corner is fully seated below this clear wing, but this side is sticking up just ever so slightly. If you see that, you can just manually snap it down with your fingers to ensure both back corners of that transmitter get fully seated below these clear wings of the sensor pod. Great, so once you've inserted that sensor and transmitter onto your skin, if you're using the receiver, you should then check the Bluetooth symbol in the upper left-hand corner. Initially, that Bluetooth symbol is flashing or blinking. And so once you've inserted a sensor and transmitter onto your skin, within 10 minutes or up to 30 minutes after inserting that sensor onto your skin, that Bluetooth symbol should stop flashing and become solid. Once that Bluetooth symbol is solid, that means that your receiver has successfully paired with that transmitter on your skin. So it means that your receiver is communicating with that transmitter. Once that Bluetooth symbol is solid, you can then go ahead and tap Start Sensor. But again, you want to make sure you wait up to 10 minutes or even up to 30 minutes for that Bluetooth symbol to stop flashing and become solid before selecting Start Sensor. Once you tap Start Sensor, that will launch what is known as the 2-hour warm-up, which is represented by a little pie chart in the upper right-hand corner. So anytime you insert a new sensor onto your skin, every 7 days, it is always going to go through this 2-hour warm-up where you will not see any glucose readings and you will not get any alerts. At the completion of the 2-hour warm-up, it will ask you to perform 2 consecutive calibrations. And what we mean by calibrate is you have to check a finger stick on your glucometer and enter it into your device. When you do this, this is called a calibration. So to complete that calibration, you'll tap on the word OK on that calibration prompt, check a finger stick, and manually enter that finger stick number into your receiver. You'll repeat that process a second time, meaning you'll check another finger stick and enter it into your receiver. Once you've entered in those first 2 calibrations, your receiver will then display your current glucose number on the home screen. Now, your app will follow a very similar process. So once you've inserted a sensor and transmitter onto your skin, the app will pair with that transmitter within about 30 minutes. Once they successfully pair, you'll then be able to tap Start Sensor to launch that 2-hour warm-up. At the completion of the 2-hour warm-up, the G5 app will also ask you to perform your first 2 calibrations. So to do that, you'll tap on the green circle to bring up your keyboard. You'll check a finger stick and enter that finger stick number into your app. You'll then repeat that process again, by checking another finger stick and enter that finger stick number into your app. Once you've completed those first 2 calibrations, your G5 app will then display your current glucose number on the G5 app home screen. Now, you need to continue to calibrate your Dexcom once every 12 hours in order to maintain the accuracy on the device. And just to clarify, it is just a single finger stick or a single calibration you have to perform every 12 hours, as opposed to the 2 calibrations you have to perform at the completion of a warm-up. And both your receiver and your G5 app will provide you with warning prompts or provide you with a calibration prompt every 12 hours. So every 12 hours, you will see a little red badge appear next to the glucometer icon on that home screen. And this indicates that you are now due for a calibration. So when you see this, you'll check a finger stick, you'll tap the glucometer icon, and manually enter your finger stick number into your device to complete that calibration. Now, there are some tips we have for you in regards to calibrating. One is that you should use a fingertip only when checking a finger stick you're going to use as a calibration. You should also try and use the same glucometer for each sensor session in order to maintain the accuracy on your device. Also, you can only calibrate with a glucose number that is between the range of 40 to 400. And you should never calibrate your Dexcom if you see any kind of error prompt on the device, such as 3 question marks or a no readings prompt. Now, your sensor is good on your skin for 7 days. So if, for example, you insert a sensor on a Sunday, you would be due to change out that sensor the following Sunday. On that 7th day, you will receive warning prompts on your display device that your sensor session is about to end. You will receive warning prompts 6 hours in advance, 2 hours in advance, and then 30 minutes in advance of your sensor session ending. Once it officially ends, it will say replace sensor now or sensor expired, and you will no longer get glucose readings on the screen. Now, it's very important for you to know that if you did want to change out your sensor early, meaning before you get the replace sensor now or sensor expired alert, or essentially if you still see glucose readings on the screen and you want to change out your sensor, you can do so, but you must select Stop Sensor in the main menu. If you get all the way to the point where it says replace sensor now or sensor expired, and you no longer see glucose readings on the screen, it has already ended the sensor session for you, and you do not need to select Stop Sensor in the main menu. Now, once your sensor session has officially ended, you'll need to remove that sensor from your skin. To do that, you'll simply peel that sensor off your skin like a Band-Aid with that transmitter still attached. You'll then need to work on removing that transmitter from the sensor pod, because the transmitter is a reusable piece that you need to continue to reuse for the next 3 months. Do not throw away your transmitter. You'll reuse the same transmitter with each sensor insertion for the next 3 months. One way you can remove the transmitter from the sensor pod is by simply using your fingers. You can grab onto those clear wings on the back of the sensor pod and just pull those clear wings out and away from the transmitter. Another method you can use to remove that transmitter from the sensor pod is by using the safety lock. So you can actually hang on to the safety lock and use it as a tool at the end of your 7-day sensor session to help you remove the transmitter from that sensor pod. If you use the safety lock method, you'll first need to place your sensor pod and transmitter on a hard surface. You'll locate the U-shaped cutout in that safety lock and wrap it around the back width of the transmitter, right in between the letters D and E for the word Dexcom. You would then press down on that safety lock and pull up on it, and that would take the transmitter out with it. Now, both your receiver home screen and your G5 app home screen look very similar. Both will display your trend graph at the bottom of the screen, which is plotting your glucose as data points as you progress through your sensor session. Directly above that is your current glucose number along with your trend arrow. In the far upper left-hand corner is your main menu icon, and right next to that is your glucometer or calibration icon. To the right of that is an icon of a person running, and this represents events. So you can enter various types of events into your Dexcom, such as how many grams of carbs you consumed or how much insulin you administered. And all of that information will be recorded and saved for you and your doctor to look back on. Now, one icon that is present on the G5 app that is not present on the receiver is the share icon, which is represented by a dotted triangular symbol in the upper right-hand corner. Now, share is only available on a smart device because it requires an active internet connection to function properly. But Share is a really exciting feature because it allows the Dexcom user to share their glucose information in real time with up to 5 family members or loved ones called followers. And the followers can install the Follow app on their smart device and view the sharer's current glucose number and receive alerts when that sharer's glucose is too high or too low. To set up Share, you simply tap on the Share icon and it will walk you through the Share setup, including how to invite your followers. Now, another benefit that your Dexcom offers is a trend arrow. And the trend arrow will usually always be displayed on your home screen, telling you the speed and direction of your glucose. You can think of the trend arrow as helping you to see into the future. It's providing you with predictive information so that you can anticipate where your glucose is going to end up within the next 15 or 30 minutes. And this is what helps you take a more proactive approach when managing your diabetes, where you can really prevent a lot of the lows and the highs from happening in the first place. So if, for example, your Dexcom said that you were 110 with 2 arrows pointing straight down, that would indicate that your glucose is dropping rapidly from a baseline of 110. And even though you're not hypoglycemic yet, you're likely to become hypoglycemic soon. Within just 15 minutes, you could go all the way from 110 all the way down to 65. So the trend arrows can really help you prevent the low. You could take action at that point in time, take possibly glucose or food to prevent that low from happening in the first place. Now, there is an alert on your Dexcom that pertains to those trend arrows called the rise and fall rate alert. This alert is defaulted to off, but if you choose to turn it on, it would mean that your device would alert you when your glucose is rapidly rising or dropping, as shown by a single or a double vertical arrow pointing straight up or straight down. It would just be a way to make you immediately aware of that rapid change, prompting you to take potential action to prevent that low or that high from happening in the first place. Now, another alert you should be aware of that your Dexcom offers is something called the high and low repeat alert. But to understand the repeat feature, you need to first understand how the alerts will work on your Dexcom. So when you receive an alert for a high or a low glucose on your receiver or your G5 app, that alert will repeat itself every 5 minutes until you clear or acknowledge the alert. To clear or acknowledge an alert on your device, you'll tap the word OK that will display on the screen when you're having a high or a low glucose. When you tap the word OK, it really does clear or silence the alert, meaning that even if your glucose continues to be high or continues to be low, you will not get any further alert unless you set up a repeat alert. So the repeat alert allows you to pick an interval of time in which you want that Dexcom to re-alert you if your glucose continues to be high or continues to be low, even though you had cleared that initial alert. So the repeat alert is defaulted to off at 0 minutes. But if you choose to turn it on, you want to make sure that you select an interval of time that is helpful without creating too many alerts. Some people choose to set their high repeat at about 2 hours or 120 minutes, since it possibly might take that long to see the effect of their rapid acting insulin on a high glucose. Some people choose to set their low repeat between 15 or 30 minutes, since it may possibly take that long to see the effect of glucose on a hypoglycemic episode on their Dexcom. But these types of things can vary from person to person, so you should always consult with your doctor when determining where to set your alerts. Now, both your receiver and your G5 app have an urgent low alert set at 55 milligrams per deciliter. This alert cannot be turned off or modified in any way. It's an inherent safety feature, so that way you're always alerted in case of a severe or potentially even life-threatening hypoglycemic episode. Now, if you're using the G5 app, it's good to know that the alerts on that app have the ability to override your phone settings. So if the volume on your phone is set to silent or do not disturb, the first alert you get on your device when you're having a high or a low glucose will be a vibration only. But if you miss the vibration and you don't clear it, it will result in an audible sound with increasing volume every 5 minutes until you clear that alert, even though your phone is on silent. Now, there is a vibrate only option that you can select for the high and low alert in the alert menu of your G5 app. If this is selected, it means that your phone would vibrate only every 5 minutes till you clear the alert, regardless of your phone settings. Now, you also need to make sure that you set your receiver sound, or the type of alert or sound you want the receiver to make when you're having a high or a low glucose. To do this, you'll need to access the main menu on the receiver. There you'll select the option of sounds to then display a list of sounds that you can choose from. One of the first sounds you can choose from is vibrate, and this means that your receiver would vibrate only every 5 minutes till you clear the alert. The one exception to this is if your glucose hits that urgent low of 55, the first alert will be a vibration, but if you miss it and don't clear it, it will result in an audible sound 5 minutes later. The next option you can choose from is soft. This is one of the quietest or most discreet tones. The next one is normal, which is a little bit louder. The next one is attentive, which is the loudest. The last option you can choose from is hypo repeat. This has a similar tone to normal. The only difference is if your glucose hits that urgent low of 55, it's going to repeat itself every 5 minutes till you clear the alert, as opposed to every 5 minutes. It's going to repeat itself every 5 seconds as opposed to every 5 minutes until you clear that alert. Now, in terms of how the receiver alerts work, it's very important to note that the very first alert you get on your receiver is always going to be a vibration only, regardless of what sound you select here. It's only if you miss the initial vibration and don't clear it that it will then result in that sound that you've selected here 5 minutes later. Now, to pick the sound that you want, you'll just simply tap on it to create a check mark next to it. You can then tap try it to sample that sound. Now, your receiver needs to be charged approximately every 1 to 2 days, and you can charge the receiver in a wall outlet using the USB charging cable and power adapter that came with your system in the receiver box. Every time you charge your receiver, it will always display a speaker test prompt, asking you if you want to test your speakers or make sure they are working properly. If you choose to test your speakers at that time, you can tap Test Now, and you should make sure that you hear an audible alert and feel a vibration on your receiver. If for some odd reason you do not hear an audible alert, tap No and contact technical support. Now, it's good for you to also be aware as to what kind of accuracy you should expect to experience when using your Dexcom system. Meaning how close should you expect your Dexcom number to be to your finger stick number? Sometimes they will be the exact same number, but more often than not, they will be close or similar. And as far as how close they should be is if you check a finger stick and you happen to get a reading that's 80 or less, your Dexcom should be within 20 points. But if you check a finger stick and it is over 80, then your Dexcom should be within 20%. So if, for example, you check a finger stick and it's 90, 20% of that would be about 18, and that would mean that you shouldn't see any more than an 18-point difference between your Dexcom and your finger stick number. But if you check a finger stick and it's over 80, or if you check a finger stick, let's say it's under 80, let's say it's 70, then your Dexcom should just simply be within 20 points of that 70. Now, one very exciting feature of your Dexcom system is that you can use it for treatment decisions, meaning you can use the Dexcom glucose number to help you determine when to treat for a low or when to correct for a high without having to check a finger stick. And this is really exciting because it can potentially reduce the number of finger sticks that you're having to do a day. It's possible that you may only have to check on average about 2 finger sticks a day for the 2 calibrations that you have to perform. But in the beginning, you should continue to use your finger stick for your treatment decisions until you understand how the Dexcom works for you. In the beginning, when you first start using your Dexcom, you should compare your finger stick number to your Dexcom number in different situations, such as after correcting for a hypoglycemic episode, or on day 1 of your sensor session versus day 7 of your sensor session. And once you understand how the Dexcom is working for you and you feel confident that it's tracking your glucose appropriately, then you can start using it for your treatment decisions. But once you start using it for your treatment decisions, there are some things you should know. One is that you should only treat off a Dexcom number that's displayed concurrently with a trend arrow. Now, the trend arrow is usually always displayed on that home screen of your device. But if for some odd reason there is no trend arrow displayed and just a glucose reading and you had to make a treatment decision at that moment, you should use your finger stick in that scenario. Also, you should know that your Dexcom has a contraindication with Tylenol, also known as acetaminophen. If you take Tylenol, it can cause inaccuracy or falsely high readings on your device. So ideally, you should try and avoid this medication if possible, but if you absolutely had to take it for some reason, you would want to rely on your finger stick while that Tylenol is active in your body. And be careful because Tylenol is hidden in quite a few medications, such as over-the-counter cold medications, for example. Now, also, you should never dose off a Dexcom number that does not seem consistent with your symptoms. If for some reason you experience symptoms that do not seem consistent with your Dexcom number, you should verify it on a finger stick. Also, make sure you continue to calibrate your Dexcom once every 12 hours in order to maintain the accuracy on your device to help ensure that you're dosing off good, accurate readings. Now, when you first start using your Dexcom, it can be rather shocking or even eye-opening to see just how high your glucose numbers go at times, particularly after a meal. This can sometimes make people feel very anxious, where they start taking consecutive rapid-acting insulin doses very close together. And this is called insulin stacking, and it can result in severe hypoglycemia. So when you're using your Dexcom, just still be very mindful that you space one rapid-acting insulin dose to your next rapid-acting insulin dose by at least 2 hours, or however long your doctor advised you to. So you should consult with your doctor when determining how to use your Dexcom G5 for your treatment decisions. Now, one additional feature that your Dexcom offers pertains to Dexcom CLARITY. So CLARITY is the reporting software that allows you and your physician to retrospectively review all of that Dexcom data that it's been collecting over time. And CLARITY helps you and your physician focus on the detection of your glucose trends and patterns, meaning it helps you and your doctor identify the times of the day or the night where your glucose is typically running high versus low. And this will help you and your doctor make much more targeted and effective adjustments in your treatment regimen. Now, your receiver has the capability of saving and storing the most recent 30 days of glucose information. So to upload this information into CLARITY, you should access CLARITY's website on a computer at clarity.dexcom.com. There, you can follow the instructions, attach your receiver to the computer using the USB charging cable, upload your information, and review your CLARITY reports. If you're using the Dexcom G5 app, the Dexcom G5 app will automatically send your glucose information to your existing CLARITY account every 3 hours via the internet connection on your smart device. So whenever you log into CLARITY, it's very important that you log in with the same username and password as you did with your original G5 app login. Now you can also access CLARITY through the CLARITY Report app that you can install on a smart device. The CLARITY Report app allows you to generate reports on your smart device, and it provides you with two options in which you can share your CLARITY reports with your physician. You can either generate a sharing code and provide it to your clinic, or you can accept an email invite that your clinic would have sent you. Now, one last piece of information we want to review with you today pertains to traveling with your Dexcom through airport security. So if you're going to be traveling with your Dexcom through airport security, your Dexcom should only pass through a metal detector. No component of your Dexcom should pass through an X-ray machine or a body scanner, also known as an AIT or millimeter wave scanner. While you're on a plane, it's safe to keep your receiver turned on, both during flight and during takeoff and landing. If you're using the smart device and you turn your smart device on airplane mode, make sure you return back to the settings option on your device and turn Bluetooth back on. That will preserve that Bluetooth functionality while remaining in airplane mode so that you can continue to get glucose readings and alerts on your device while you're on an airplane. Great, so that completes our webinar for today. Thank you so much for joining us. We encourage you to check our website for additional webinars that we offer. For example, we offer webinars that provide additional detail on Dexcom CLARITY and additional detail on how to share your CLARITY reports with your doctor's office. And I'm part of the patient care department. We are a group of diabetes educators here to provide you with training, answer your questions, and provide you with ongoing support. So if you need anything at all, please don't hesitate to reach out. We look forward to supporting you, and thank you for joining our webinar.